and come off mute if you want to speak, by all means. Okay. So good morning, everyone. It's the 14th of July this morning. Hope everyone's had a good Monday, and looks a bit cloudy today, but hopefully it's going to brighten up. So I've got a couple of updates for you this morning. I just wanted to share some slides with you first of all this morning, just on some epidemiology. So hopefully everyone can see my slides this morning. I just really wanted to show you sort of the COVID cases since the start of lockdown, where they are, and we can see the trajectory's gone all the way down. So these slides are up to date until about 7 to 10 days ago. So we can really see here the numbers have significantly dropped, which is great. And then if we look in the boroughs again, it's really the same trend throughout the 5 NCL boroughs, but we can see really how low it is at the moment. And then this is the cumulative cases across all boroughs in London, and then there's the England there as well. And so it really shows where things are really, and puts us into perspective in terms of numbers. And then really, I just wanted to show you in terms of hospital admissions in NCL. We can see here we've had the highest numbers here really across the 5, and this is sort of the average, but really. And this is certainly at the peak. So we have been quite significantly high in NCL. So I just wanted to make your colleagues aware of that. And then again, the gender, if we're comparing genders as well, you can see that the number of men admitted is significantly higher than women. And then if we look at ages, again, we can see that the over 85s are the highest, and obviously it goes down as the age decreases, which we would expect and we've known. Okay. And then finally, I just want to show you this slide, which is the ethnicity slide. So we can really see here that other ethnic groups have really higher rates of admissions and have become more poorly in hospital. So I think that really goes back to how we should be doing risk assessments for our colleagues in primary care if they are from different ethnic groups, because they are at higher risk. So I think those slides really do show that. If anyone wants access to those slides, they are available to you. I'll share the link on the chat bar at the end of this webinar. So at the end of the webinar, I'll share the link in the chat bar, which you can go back and access. And if you want to look at those slides in your own time, feel free to. They are now public and are shareable, so that's great. So I'll share those on the link. The next thing I wanted to tell you about was phlebotomy. So I wanted to let you know that Finchley Memorial Hospital now has the capacity to do approximately 800 blood tests per calendar month. And this is the same capacity that there was at Finchley pre-COVID. What CLCH have been doing, they've been using all 5 phlebotomy rooms all at once. So that's really great news. That the capacity has actually gone back to pre-COVID, and the Royal Free confirmed yesterday that they're due to reopen Edgware for phlebotomy on Monday, and that's Monday the 20th. I'm not told details of what the numbers they're going to be seeing at the moment at Edgware are, but I'm sure we'll get informed in the coming days or next week. The next thing I wanted to highlight to colleagues is really an issue that I was told about yesterday, and that is with domiciliary phlebotomy, so through our district nursing team. So we got alerted yesterday that actually the numbers of referrals have increased by about 5 times the usual number pre-COVID, and that our colleagues in the district nursing team are struggling. So it's just for colleagues to be aware that this is going on at the moment, because they're struggling, and so we might be seeing longer waits for domiciliary phlebotomy. So they've got the maximum number of staff working. They've got more staff working in domiciliary phlebotomy than pre-COVID, because they've pulled staff from the walk-in centres and places like that where they're not using staff. So actually they've got more staff than pre-COVID in district nurses, and they're still not coping. So we could be seeing a couple of weeks wait for blood tests. So it's just to be really mindful of that. And we're working with our community provider to try and work out a solution. On a personal level, I hope that as people sort of come out of shielding by the end of this month, less people will become technically housebound due to shielding, and they may be able to access sites like Finchley, Edgware, Royal Free, etc. And certainly as the capacity ramps up on those sites, there'll be more appointments. And certainly at Finchley, the waiting time is not more than a couple of days at the moment, which is quite good. The next thing I wanted to update you on was Consultant Connect. As I spoke to you about 2 weeks ago, cardiology went on as local consultants. So when you ring cardiology between 9 and 5, it's answered by local consultants. At the moment, we're in talks with respiratory, gastroenterology and neurology. They're going to be joining Consultant Connect locally in the coming weeks, hopefully. So that would be really great. And I'll give you an update when they're on, which would be really great. So I'll keep you posted about that. The next thing I wanted to update you on is about the online recovery service for COVID-19, which has been announced by NHS England. And it's not live yet, but I just want to tell you a bit about what information NHS England have given us. So this is a service that's going to be coming online for patients where nurses and physiotherapists will be able to reply to patients' needs either online or by telephone. All those patients have been in hospital or suffered at home and will have access to face-to-face consultations with rehab teams, really. And they'll also include mental health specialists. So really, that could be either online or by the phone. They'll have exercise tutorials, online peer support, mental health support, and psychologists and things like that. So I know that is coming in the coming weeks. So we'll keep you abreast and informed of when we hear more information about that. And certainly, I'm sure that NCL will be doing something maybe sort of unique to NCL, but I'm yet to hear the exact details. But I thought I'd just give you the heads up about that. The final thing I wanted to let you know this morning was that I know that it was a fantastic end-of-life palliative care webinar last week. A lot of colleagues attended that, so that was fantastic. And I just wanted to remind, I know I did mention this before, but a lot of people have asked this. I'm just going to re-mention this. The pharmacies across Barnet that have agreed to stock end-of-life care medicines at all times. I'm just going to remind colleagues, there's been a lot of questions about that. It's Boots in Edgware, Oakley Pharmacy in Whetstone, Fairview Pharmacy in Finchley Memorial Hospital, Tesco's in North Finchley, Woman Freed in Golders Green, and Care Chemist in Mill Hill. So just to remind colleagues. Okay, so I'm going to pause there this morning. Nothing more for me to add there, unless there's any questions from colleagues. Tao, you've got your hand up.
Thank you, Nick. In terms of the increased capacity for phlebotomy, it's great news. Are we allowed now to start sending more for routine bloods, or are we still expected to use, for example, Finchley Memorial just for urgent?
Yeah, so there is a really good question. There is a slight backlog there they're trying to clear up. So essentially, pre-COVID, the wait time was 6 weeks. Now the wait time is about 6-7 days. But what they are trying to do is prioritize urgent bloods. So you could write down two things, either the word urgent or the word essential. So when it's urgent, they will prioritize it as first priority, and when it's essential, it'll be second priority. And that also makes a difference when it hits the lab, because what's happening at the moment is that when we're writing urgent on all the blood test form, when it goes to the Royal Free, they're saying everything says urgent. They don't know what to process first. So if we could try and use the word urgent and essential, they'll still get done, but they might be waiting the 7 days, whereas urgent might be saying, okay, come down tomorrow type thing. So we're talking about a couple of days difference, but it just allows for planning. So I hope that answers your question.
But I guess they wouldn't turn away people who we just put or we would just send for routine, diabetic bloods, whatever. We're happy to wait maybe for a month or two. They will not be turned away.
No, they might not be given an appointment, certainly in the next day or two, but they will be given a future appointment. Yeah, absolutely.
Thank you. Thanks, Nick.
No problem. Are there any other questions from colleagues? Okay, if you do think of any questions, pop them in the chat bar. I can answer them between now and Friday or on Friday. And I'm just going to share at the end of this webinar, I'll share the link to the website for the statistics so everyone can have a look at those in their own time. And feel free to share those with colleagues in the borough as well. Okay, everyone have a good morning, and I'll see you all on Friday. Have a good week.
Thank you, Nick.
Take care, everyone.
Thank you.